Millions more Americans will soon get Moderna's version of the vaccine. The first shipments arrive today at hospitals around the country. Moderna's vaccine is just as effective as Pfizer's, but it doesn't require sub-zero storage. And in the last few hours, that vaccine arrived at Coatesville VA Medical Center. Now, the VA already started vaccinating healthcare workers and residents in community living centers. Joining us now is Guy Weston. He's from the South Jersey area. He took part in the trials for Moderna's vaccine. Guy, thank you so much for taking the time with us. What compelled you to want to take part in the trial?
Well, I think it's very important. I'm a public health professional. I've worked in public health for over 30 years. And so people in my field understand clinical trials. We understand the importance of diversity in clinical trials. So it's up to us to model that confidence so other people can be confident. But I also am reminded that so many people have been impacted by this. 88,000 Philadelphians have been diagnosed, 2,300 have died. I have relatives that I learned just today, a school-age child was diagnosed with COVID. His parents are being evaluated. I have a very close colleague in Philadelphia who was in his 4th week of quarantine of isolation, because he has COVID. It's something that we all have to pay attention to. And it's something that's not going to change if we don't do something different in the future than we did in the past.
Yeah, certainly. Back to the trial now. Did you ever find out whether you had the actual vaccine or a placebo? And also, how did you feel afterwards?
Well, I didn't feel bad at all. So there are 2 inoculations, 29 days apart. After the first one, I didn't feel anything. 13 hours after the second one, I felt a sudden onset of chills and fever that lasted no more. Actually, the chills subsided pretty quickly. The fever lasted for a day and then it abruptly stopped. So talking to the investigators, it's very clear that there's no other explanation for getting that exactly 13 hours after the inoculation, except that I got vaccine. And I actually wanted to have side effects so I would know that I got vaccine. So I was happy about that.
Yeah, there's your confirmation. What would you say to somebody who's reluctant to get this vaccine, who may hear some stuff on social media, they may feel that they're dissuaded? What would you say to them?
Well, the first thing you have to do is meet people where they are. I am left-brained. I'll give you left-brain facts. That may not resonate with people. So I'll ask them, what would it take for you to get the vaccine? Some people will get the vaccine after they've seen other people that have had it do well and not have any negative consequences. But I would try to answer the questions, but meet them where they are. There are a couple of things I would say. There were more than 30,000 volunteers in the trial that I was in, for example, and none of us, my hair didn't fall out because I had the vaccine. And then another important fact is that this vaccine, unlike prior vaccines, most vaccines, if not all in the past, contained weakened virus. This one contains a synthetic molecule that induces a protective response from your immune system. So you're not getting exposed to a germ that's going to make you sick. But the important thing is to meet people where they are, answer their questions, recognize that only 49.5% of people got flu vaccines last year. So this is not new science of people not taking vaccines. Understand what people's concerns are and respond to those.
Yeah, great advice, good information as well. Guy Weston, thank you so much for your time.
Certainly, thank you.